Does the use of Viagra cause addiction? Welcome to the Ask Fabio blog. I am Dr. Fabio, an andrologist in London, and I am an avatar created with artificial intelligence. I am standing in for Dr. Fabio in this video.
Hello, I am Alex, an artificial intelligence avatar. I do not exist in reality. Dr. Fabio, thank you for taking the time to meet with me today. I've been doing some research on treatments for erectile dysfunction, and I came across PDE5 inhibitors. I've read some forums where people express concerns about dependency. Can you tell me more about that?
Of course, I understand your concerns, and it's great that you're seeking accurate information. Let's start with the basics. PDE5 inhibitors are a class of medications commonly used to treat erectile dysfunction. They work by enhancing the effects of nitric oxide, a natural chemical your body produces that relaxes muscles in the penis, increasing blood flow and allowing an erection in response to sexual stimulation.
I see, but what about the risk of becoming dependent on these medications? Is that something I should be worried about?
It's a valid concern. However, the vast majority of men who use PDE5 inhibitors do so without developing any type of physical or psychological dependence. This is a question we get all the time, especially from younger men who may need to use these medications for a period. It's important to differentiate between dependency and the necessity of using medication for a medical condition.
That's interesting. But are there any cases where these medications become less effective over time, or where a person might feel they can't function sexually without them?
Some medications can indeed lead to decreased efficacy over time or dependency, but PDE5 inhibitors are different. For reasons not fully understood, they don't seem to result in dependency, reduced efficacy, or addiction. In fact, based on more than 20 years of clinical use, these drugs remain just as effective over time. If anything, patients often report that the efficacy of these medications increases as they become more accustomed to the effects, and side effects tend to decrease.
That's very reassuring to hear, Dr. Castiglione. But what happens if someone decides to stop taking them suddenly? Are there withdrawal symptoms?
Another excellent question. These drugs are not linked to physical addiction, meaning you will not develop a physical dependence on them or experience withdrawal symptoms if you stop using them suddenly. It's always a good idea to consult with your healthcare provider before making any changes to your medication regimen, but the risk of withdrawal from PDE5 inhibitors is essentially non-existent.
This information has been incredibly helpful, Dr. Castiglione. I feel much more at ease about considering this treatment option now.
I'm glad to hear that. It's important to have open and honest discussions about these concerns. Erectile dysfunction can be a sensitive topic, but it's a common issue, and there are effective treatments available. If you have any more questions or need further clarification, I'm here to help.
Thank you, Dr. Fabio. I appreciate your thorough explanations and the time you've taken to address my concerns today.
You're welcome. Remember, my goal is to ensure you feel supported and informed about your health choices. Thank you for trusting me with your care. If you have any more questions or concerns, please don't hesitate to reach out. For more tips on male sexual health, follow my blog, Ask Fabio, and click on the bell to always stay updated. For further information or for personalized advice, do not hesitate to contact me. Thank you for your attention. See you soon.